Hello and welcome today to my COVID-19 World Update for the day. Today I'm going to talk a little bit about vitamin D in COVID-19. As I start off, just let me say ahead of time that there's some really great information out there, and probably one of the videos that I've seen on YouTube that is most informational and most beneficial to understanding vitamin D in relationship to COVID-19 is by Dr. John Campbell. He's a medical professional in the UK. He's got a well-followed YouTube channel, and I'll put a link to his vitamin D video in the comments of this, and I recommend you watch it. So here we have some rudimentary drawings. This over here is a rudimentary drawing of how the lungs come down from trachea and branch out into the bronchi and then into smaller and smaller branches going down into minuscule level, kind of similar to an upside down tree, but the leaves on that tree are the alveoli, which is depicted here. And what the alveoli essentially are is a flexible sac of tissue that can fill with gases and then be emptied of gases according to the pressurization that's coming in as the diaphragm expands and contracts in order to inhale and expel air from the lungs. And the alveoli are, the critical part of lung function in that there are capillaries that run with blood flow next to the alveoli, and there is transpiration of oxygen into the alveoli and carbon dioxide out of the alveoli into the capillaries. So this is what oxygenates our blood and allows us to use that oxygen then to live, essentially. If this critical mechanism is not functioning, then we end up with low oxygenation levels in our blood and ultimately can die from the lack of oxygenation. So in COVID and other infections that affect the lungs, one of the things that can happen that can be deadly is a condition known as ARDS, acute respiratory distress syndrome. And what happens in acute respiratory distress syndrome is that as the infectious particles get into the alveoli in the lungs, the immune system of the body responds. And it responds by sending different immune system cells, either cytokines or macrophages, dendrite cells, to respond to the infection. And one of the results of that is that you can get inflammation that happens between the capillaries and into the cell wall of the alveoli. The alveoli are made up of multiple cells. So if that happens, you can end up getting more fluid passing into the alveoli. And ultimately what that can cause is that the alveoli can fill up with fluid. You also get other effects that can get kind of like junk particles that'll develop along the wall of the alveoli that can make them stiff and not as breathable. So rather than being like a tiny little balloon, it'll become more like an egg, and it won't be able to expand and contract properly. And so in COVID-19, what ends up happening in a lot of the cases that are fatal is that the the alveoli themselves become compromised to the extent that even on a ventilator where the medical professionals are actually essentially pushing oxygen into the lungs and pulling it and pulling back out in order to essentially help the person breathe, there just isn't enough function left in the alveoli to get any oxygen into the system. So, and most of that is due to an immune response. You've probably heard the term cytokine storm. Well, that's an immune response that essentially runs away with itself. Now, the reason why this is important for vitamin D is that because one of the chemicals that is a follow-on to vitamin D is used to regulate this immune response. It's used both to turn the immune response on, and the body also uses it to kind of put the brakes on the immune response. So it has been theorized that a lack of vitamin D in patients with ARDS, or better say, a lack of sufficient vitamin D could be one of the causal factors in ARDS. So that's what we're going to look at today. This slide here is from the Journal of the American Board of Family Medicine, and I've put the link up here in the right-hand corner if you want to go to take a look at this study that was done. And this study shows that for a given weight and a given ethnicity, which are these lines here, you have a greater probability of deficiency of vitamin D. Okay, so let's say, for example, for myself, I'm right around 100 kilos, right? So this is the weight in kilograms. So if you draw a line from the weight going straight vertical, you'll see that as a non-Hispanic white person, my probability of vitamin D deficiency is less than 25%. In other words, less than 25% of the population that are non-Hispanic whites and my weight range are going to be deficient in vitamin D. But if you take that up to a Mexican American of the same weight, half of Mexican Americans on average will be vitamin D deficiency. Now, there could be a lot of different causes for this. One of the most likely causes is the actual skin tone, because lighter skin makes vitamin D more efficiently. If there's more melanin in the skin, you make less vitamin D. Now you take that up to the extreme in this example, and then you're looking at non-Hispanic blacks, so African American blacks are 75%, or I should say 3 times, let's put it that way. It's a 75% likelihood that they'll be vitamin D deficient, or you could say 3 times as likely to be vitamin D deficiency as a white person of the same weight. And you can see that the actual weight of the person makes a big difference, which makes sense because when you're talking about vitamin D levels, you're talking about nanomoles per microliter, if I remember correctly. It might be milliliter that they're measuring it in. So the heavier you are, the more it's going to spread out among your tissues, and the harder it would be to get to a sufficient volume. So let's remember that. We've got 3 times the likelihood that a black person is vitamin D deficiency versus a white person of the same race. Okay, and this particular study was age adjusted, so age isn't taken into account on this presentation. So now we're going to take a look at the hospitalization rates by race and ethnicity for COVID. And this is from March to June 13th, 2020. And this has actually got American Indians in it, blacks, Hispanics, non-Hispanics, Asians or Pacific Islanders, and whites. Okay, so if we take a look at those same relationships that we saw in the prior slide, you can see that black people were more than 4 times as likely to be hospitalized with COVID-19 versus non-Hispanic white people. The Hispanic also had quite a high level of hospitalization also. And if we just take a quick look back at the previous slide, you can see that there's kind of a relationship there, right? Okay, so important to note here then is we see correlation, but correlation is not causality, right? So we can see various correlations, and that can create a hypothesis, but you don't prove the hypothesis in this case until you do a double-blind controlled study with placebos to prove that if people have adequate blood levels of blood serum levels of vitamin D, that they are less likely to contract COVID, or perhaps more importantly, less likely to have significant complications from COVID. So here are 3 studies that I've taken a look at with regards to vitamin D in COVID-19. The first study from the British Medical Journal found that vitamin D supplementation did seem to play a role in preventing acute respiratory tract infections. And COVID-19 in its serious form is an acute respiratory tract infection. Now, this study was done prior to COVID-19, so it was looking at things like pneumonia and bacterial infections that could go to the lungs, and what was the likelihood that the patient would end up in significant danger. This is the link for that study. You can take a look at it, but this study essentially proved or showed, again, sorry for using the word proved, it showed that there is a correlation between vitamin D sufficiency and prevention of acute respiratory tract infections. The second study was a study that was done in Japan on a group of Japanese school children, and this study actually showed that children who were receiving the vitamin D supplement were half as likely to get the flu in any given year. So the children who were not receiving the vitamin D supplement were twice as likely to get the flu in that school year. This study was done in 2010, so also pre-COVID, but it would suggest that having the vitamin D available to the immune system in order to regulate the immunoresponse may have an effect that could even create a situation where the body can fight off an antigen before it has time to even take hold and create an infection, which is pretty interesting. And then this third study, it's reported in the NIH journals here, or that's where I linked to it from, but this was actually a study out of France that just finished earlier this month in June that shows again a strong correlation between vitamin D deficiency and comorbidities and death in COVID-19 patients. And actually it showed correlation that it was more likely that a COVID-19 patient would have a comorbidity such as obesity or diabetes or heart disease if they were vitamin D deficient. And then obviously that ends up resulting, because of those comorbidities, in a higher fatality rate among the COVID-19 patients who are vitamin D deficient. So again, it's a correlation, but it's a pretty strong correlation with what the results are in real life. There are actually some double-blind studies underway now to attempt to prove, in other words, prove causality versus correlation in this, but it's going to take some time, and we're going to need to find out where it goes from here. So that brings up the question for me, how much vitamin D do you need? Now this chart is again off of the National Institutes of Health website here in the U.S., and it gives a recommended dosage for people according to their age group. So the NIH recommends for me, an adult aged 19 to 70 years, 600 international units per day. Now, let me say here while we're looking at dosages, I am not a medical doctor. I'm an engineer. I can take data and look at it, but I can't make medical recommendations. I recommend that you talk to your doctor about taking a vitamin D supplement before you do so. Ideally, you may even want to be blood tested for it to find out what your systemic level is for vitamin D. But looking at this recommendation of 600 international units per day for adults 19 to 70 years, it seems a reasonable amount. The supplement that I take is 1,000 international units, and then I have a fish oil supplement that has another 1,000 international units in it. And again, this is me, not a doctor, me being an engineer. I figure I'm a little bit heavier, so I should probably be taking a little bit more. Now, I did find in the literature at least one case example where it was pretty well proven that an individual nearly killed themselves with vitamin D overdosing. So it is possible to overdose on vitamin D, and the typical path that would take would be kidney damage, because the kidneys would be the organ that would end up cleaning out the excess vitamin D. So just like, too much ibuprofen can harm the liver, too much vitamin D can harm the kidneys. In that particular case, that man was taking 4,000 international units per day. So that is nearly 7 times the recommended amount. There is something that was in the French study where they were actually providing what they call a bolus dose. And a bolus dose is essentially a massive push of vitamin D. In their case, it was 50,000 international units that they were giving on a one-time basis in order to try to bump up the vitamin D levels in the blood on a one-time basis, and then continue from there with daily doses. That study actually found that the bolus dose didn't make a difference, but doctors frequently will use that if they find a patient that has low vitamin D levels in their blood. They'll give them a big, massive dose to start out, and then they'll take it back to a daily supplementary dose. But I think that French study essentially showed that if you are already vitamin D deficient when you contract COVID-19, there's not a lot you can do about it at that point with regards to vitamin D. You need to take care of that ahead of time. So go through the materials, take a look at the studies, take a look at what the NIH recommends with regard to vitamin D, talk to your medical professional, and ask them if it's a good idea. If you could get it, I'd get a blood serum level to find out what your current amounts are. I know we've all been living indoors quite a bit over the last few months, and vitamin D is produced naturally by the sun on our skin. And if we don't have the sun on our skin, we're naturally going to be producing less vitamin D. So then we're depending on dietary supplements, whether through fish oil or vegetables or other things. Fortified milk, for example, vitamin D fortified milk helps with that. So it's a thing to take a look at. And I think overall, I'm convinced that it's a good idea to take a vitamin D supplement. Check with your health professional and see what they think. Thank you again so much for watching. If you like this update, please do subscribe. And as always, wash your hands with soap and water. Use hand sanitizer if you don't have soap and water available. Wear a face covering in public spaces. If you have difficulty wearing a face mask or a face covering, you might want to think about practicing some at home. As a scuba diver, I recognize that it can be quite claustrophobic to have something covering the face. And what I've recognized that as I practice, you get accustomed to taking deeper breaths and exhaling a little bit more forcefully. And it really does help, because once you convince your body that it is getting enough oxygen, it'll get better. So I would say practice a little bit, but obviously if you ever feel dizzy or whatever, take the mask off. And if you're having trouble with a face mask, talk to your doctor about that too, because that might be indicative that you've got something else going on that needs to be treated, because normal, healthy individuals should be able to wear a surgical mask for extended periods without too much problem. And tell your friends and loved ones to do the same. The life you save may be your mother's, your grandmother's, your aunties, your brothers, or your sisters. So let's work together and take care of each other. Thanks very much.